Hey guys, I'm Dani West and you're back with another episode of the Soapbox, and today, as promised, we were taking our theme of the spine into a clinical context. And so we're at the U of C Sport Med Clinic here, and we are going to be looking at one of the four main core muscles, our multifidus. It's our deep spinal intersegmental muscles. We're going to look at it on ultrasound today. So I have our diagnostic ultrasound all geared up and ready to go. And I've also marked out the spinous processes on my hubby, who is the model today. And as you can see, we have L5, L4, L3, L2, L1, and then we go into the upper back of the T-spine, T12. And so we're basically going to be looking at the multifidus in and along the lumbar spine here today. And the neat thing is about the ultrasound is we can actually freeze frame it on when we get a picture and measure the depth of that multifidus. And then the patient would go do their core exercises for about 3 to 6 months. We could come back, remeasure those muscles, and see if the depth has improved and see if they've been doing their core homework. So it actually works out well because my husband has had some low back pain lately. So I thought, okay, this would be perfect. We're gonna measure today, and then I'll use him as a model in a couple of months after he's been doing some Pilates and core work. And then we'll kind of see what his multifidus measurement is. So you can join us on that journey. So again, just a quick little review. Multifidus, if we look at this horribly decrepit spine here, it's had a better life. Multifidus sits deep along each of the vertebrae, and they span, again, intersegmentally among each of those levels, and they are the ones supporting the spine at the deepest level. That's our foundation. That's what we need to strengthen in order to promote proper spinal support, along with the other three core muscles, which are diaphragm, pelvic floor, and our deepest abdominal, the TA, which we'll speak to in weeks to come. So without further ado, I have to try to video with one hand and ultrasound with the other. So I'm gonna do my very best. So if we get set up here, have my little ultrasound head, and I'm just gonna kind of orient it right on L5. And if I flip to your view here, I'm gonna freeze it in a sec. But what I'm trying to suss out is where that spinous process is. So do you see that little cowboy hat figure that is forming there? That's essentially the center of the vertebrae. Okay, so very cool. I'm just gonna try to set it up here. And we're on about L5, and I'm gonna play around at L4 as well. Okay, so let's have a look-see. If I freeze it, and I just want you to notice that little cowboy hat figure, okay? And then these two kind of circular dark circle shapes there that sit in the gutter of the spine, that's the multifidus. And that's what we're gonna actually measure on a different view. So I'm just gonna switch up the view here. And we're gonna look at one side first, and then we're gonna look at the other. So again, you can kind of see I'm trying to landmark at around L4-5 so I can be as consistent as possible. And then if we look on the screen here, you see those little stegosaurus things kind of showing up? That is our transverse processes. How cool is that? That's so cool. So yeah, and you can see if I move off of them, they get blurry. But if I'm right over top of them, they start to form and look pretty clear. And before my boss Martin here showed this to me, this just looks like one big snowstorm. So again, pardon my videoing, but I'm just gonna freeze this frame here. And then we're gonna have a look at the measurements. So I'm gonna move my caliper Again, we're on about L4. And if you notice down here in the corner, 3.43, so that is the depth of multifidus, again, at around L4. And then if I take another one and go down a level here, we can also measure this one, sitting at about 3.44. Okay, so measuring kind of at the skin, down right to the bottom of the gutter, or that transverse processes, and that girth there that we're looking at, that is multifidus. And then that is something that we can actually retest in a couple of months. And we're also going to look at it real quick now on his right side, because it's neat to compare the two side to side. So that was his left side. So again, if I just kind of landmark again, we're looking at, I'm around L4. I'm going to kind of flip the screen so we can watch for our Stegosaurus. And this is the first time Andrew's seen this too. It's pretty cool. I'm going to go about there. And I'm also watching that I'm pressing the same amount of pressure each time. So again, just 1 second, I'm just going to freeze frame this. Okay, so looking at his right side, I'm going to caliper this. Okay, 3.39 centimeters. And then if I go down a level, so that would have been L4-ish, 3.29. So, little less on the right, and then, I don't know, Andrew, do you get more pain on the right or the left, or is it pretty equal?
I'd say the right.
Okay, so he gets a little bit more pain on the right. So again, he just doesn't have as much multifidus support on the right side, but it's still important, we're still gonna strengthen up both. And so people can get to like 4 something centimeters, maybe 5. But again, it's a nice objective way of actually measuring that multifidus, and super cool and geeky, like so much fun. This is the best and most expensive toy ever, but very cool. So again, if anyone's working with me on a core program, or you're interested in a core program, this is something I'm going to start adding in to the sessions as, again, just something objective that we can go off of when we're tracking core strength. So anyways, that's multifidus on the soapbox today in clinic. Tune in with me next week. We're going to give some home exercises for core and start to work our way. We're going to do a few more ultrasounds in weeks to come on TA, and also the pelvic floor. So tune in for that. Thanks so much, guys, and we'll see you later.